Autoimmune diseases are spreading, and 1 in 10 people in the world is affected. Now, what if those random signs that you have been ignoring, like fatigue, hair loss, constant headaches, or skin rashes, are not just because of stress or allergies or getting old, but actually they are early warning signs of your immune system that is turning against you? I am Dr. Girnita, a board-certified rheumatologist, and for many years I am helping people finally connect the dots between their unexplained symptoms and to get to a diagnosis of an autoimmune disease. And in this video, I will discuss the early signs of autoimmune diseases, the one that they show long before most people ever think to go to see a specialist. So stay with me because some of these signs might truly surprise you. But first, let's talk about what exactly are autoimmune diseases. In a healthy body, your immune system works like a security team, constantly scanning for infections, viruses, or anything that doesn't belong. But in an autoimmune disease, something goes wrong. Instead of protecting you, the immune system gets confused and starts attacking your own healthy cells. If the immune system attacks your joints, you might develop rheumatoid arthritis. If it targets your thyroid, it could become autoimmune thyroiditis like Hashimoto or Graves' disease. If it will affect your skin, it might show up as lupus or psoriasis. But here it is where it gets tricky. Autoimmune diseases often overlap. Someone might start with dry eyes and dry mouth like in Sjögren syndrome, and later on they can develop joint pain like in rheumatoid arthritis. One person might begin with thyroid disease and later could show up signs of lupus. Now let's go even deeper and take one sign or symptom at a time and explain it better. Number 1 is fatigue. Do you ever wake up feeling like you haven't slept at all? That's what many people with autoimmune diseases describe. This isn't that ordinary tiredness. It's your immune system in overdrive, using all your body energy as it will attack your healthy tissues. That's why many people with lupus, Sjögren's, rheumatoid arthritis, or multiple sclerosis often feel that they are wiped out long before they have the diagnosis. So number 2 are skin changes. Have you ever noticed some strange rashes, itchiness, or patches of discoloration that just don't go away? In lupus, you might see that butterfly-shaped rash across your cheeks. Psoriasis can create thick, silvery plaques on the elbows, on the knees, on your scalp. Some patients might develop rashes in the genital areas or umbilical area, and many of these people, after years of suffering from the skin disease, they develop the joint pain that we call psoriatic arthritis. Then in scleroderma, the skin can become very tight or shiny, and in vasculitis, people can develop those tiny red or purple dots from those inflamed blood vessels. Number 3 is hair loss and brittle nails. Is your hair thinning, or are you finding more strands in the brush lately? Autoimmune diseases can directly attack hair follicles, which will lead to sudden or gradual hair loss. You can lose hair in patches, like in alopecia areata, which is an autoimmune disease that can cause bald spots, but you can also use hair diffusely, like in people with lupus or Hashimoto disease. Even your nails can tell a story. Pits, ridges, or peeling are common in people with psoriasis or thyroid diseases. Number 4 is joint pain, stiffness, and swelling. Now, did you notice that your joints are aching when you wake up, or they stay stiff for more than an hour every morning? That's one of the earliest and clearest signs of inflammatory arthritis. People with rheumatoid arthritis notice that both of their hands or feet, they will ache, they become swollen, and they are very stiff in the morning. People with psoriatic arthritis can have back pain, buttock pain, or maybe one finger or one toe affected. We call this swelling of one finger dactylitis or saucy digits. Now, even people with lupus can develop joint pain in their hands, in their feet, or other joints, but they do not develop the deformities like people with rheumatoid arthritis. Number 5, muscle aches and weakness. Have you ever started feeling weak or sore even without working out? That could mean that your immune system is targeting your muscles themselves. In polymyositis and dermatomyositis, weakness begins in the thighs or in the shoulders, making stairs or lifting your arms very difficult. People with lupus or Sjögren often describe a deep, dull ache as their muscles are bruised from the inside. Number 6, digestive issues. The gut is a major player in immunity. About 70% of your immune system lies in the gut, and when something goes wrong there, then your immune system will react. Sometimes when it overreacts, autoimmune diseases can develop. Now let me give you some examples. In celiac disease, the gluten will trigger inflammation that will damage the small intestine, and that will trigger abdominal pain, nausea, diarrhea, and sometimes rashes that look like herpes. In Crohn's disease and ulcerative colitis, patients will develop years of abdominal pain, nausea, weight loss, and bloody diarrhea before they get diagnosed. And these signs are many times very subtle in the beginning, and then it will slowly become the main problem in many patients. Sign number 7, headaches. Yes, people with Sjögren's and even lupus can experience severe, long-lasting headaches for many years before they get diagnosed. People with multiple sclerosis can also suffer from headaches that they look like migraines. But if your headaches have changed or they become persistent, then maybe your immune system may be involved. Sign number 8, brain fog. Do you ever feel like your brain is running in slow motion? You forget words, you lose focus, or you feel like you are living in a mental haze. This autoimmune brain fog is real, and it is incredibly frustrating. In lupus, it's called lupus fog. In Sjögren's patients, it is a real problem that is very hard to treat. In multiple sclerosis, it's slower thinking and concentration problems. And in Hashimoto thyroiditis, inflammation can affect both the mood and the memory. Sign number 9, numbness, tingling, and pins and needles. Do you ever get that pins and needle feeling, especially in your hands or feet? In multiple sclerosis, nerve inflammation can cause numbness and balance issues. In Sjögren's disease, it can cause burning and tingling sensation. If you feel numbness or tingling that lasts more than a few days, it's worth investigating. Sign number 10, temperature and sunlight sensitivity. Lupus rashes can flare after a mild sun exposure. Hashimoto can cause cold intolerance, while Graves' disease can lead to heat sensitivity and sweating. And in scleroderma, exposure to cold can cause your fingers to turn white or blue, a phenomenon that we call Raynaud's. If sunlight or temperature swings affect you in these unusual ways, that's worth paying attention. Sign number 11, let's talk about Raynaud's phenomenon. Have your fingers or toes ever turned white and then blue and then red when you are in the cold or when you are stressed? We call this Raynaud's phenomenon, and it happens when the tiny blood vessels in your hands or in your feet will suddenly narrow, which will cut off circulation for a short period of time. You might feel numbness, tingling, or even pain as this color changes from white to blue and then red as the blood flow will return. It can look scary, but it's actually an important early clue. Number 12, unexplained weight changes, fevers, and night sweats. Have you ever noticed that your weight suddenly changes without any reason, even without changes in your diet or activity? That could be your immune system sending an early warning sign. In Hashimoto thyroiditis, your immune system attacks the thyroid gland, slowing down your metabolism. You might actually notice unexplained weight gain, fatigue, constipation, or feeling unusually cold. On the other hand, in Graves' disease, the immune system does the opposite. It overstimulates the thyroid. So suddenly your metabolism will raise, causing unintentional weight loss, a rapid heartbeat, anxiety, and even tremors. But it's not just the thyroid. Autoimmune diseases like lupus or vasculitis can make your immune system go into overdrive, creating low-grade fevers, night sweats, and unexplained fatigue that come and go. Maybe you are asking yourself, why is it important to get an early diagnosis? Catching autoimmune diseases early can make a world of a difference. It can protect your joints, your organs, and the quality of your life. And it can prevent years of pain or irreversible damage. But the truth is, delays in diagnosis are far too common. As I mentioned, people that come to my practice have wasted years seeing different doctors, treating symptoms separately without ever uncovering the real cause. That's where specialists like me, rheumatologists, will truly help. My job is to connect the dots, to see the bigger picture, and to decide which laboratory or imaging tests are truly needed to confirm whether there is an autoimmune disease and which one it is. At Rheumatologist on Call, my partners and I take the time to truly listen. We understand your story and we guide you step by step towards answers. We specialize in making sense of very complex symptoms, linking those patterns that others might miss, and helping you to find real relief. Because your journey deserves clarity, compassion, and hope. And now that you've just learned how to recognize the early warning signs of autoimmune diseases, what's happening next? The right test will uncover the truth faster, and it will help you take control of your health. So don't miss my next video where I will reveal which tests will actually matter, what do they show, and how to get your answers sooner.